Dr. Paul Barish has come forward to share a story that still haunts to this day.
I was in the last year of my medical school. I was asked by my senior resident to place a central line for feeding to a woman who had chronic lung disease and wasn't able to feed herself. I'd never done one of these before.
As Dr. Barish began the procedure, his mentor was called away for an emergency.
I looked at him, kind of opened eyes. He said, "Don't worry, you'll be fine. You're a great student. Don't worry about it."
Dr. Barish pushed the needle through the woman's vein and mistakenly into her chest wall, puncturing the air sac, which collapsed her lung.
And the resident had come back. He yelled at me for being an idiot. About 4 days later, she passed away. I was embarrassed, ashamed, angry for screwing up, angry at myself, and very unhappy. I probably should never have been doing that procedure, certainly not by myself. The way we train people and the way we allow them to do these types of things was wrong.
Dr. Barish says his deadly mistake still haunts him. Since then, he has dedicated his life to educating and training healthcare workers about patient safety. Dr. Barish says new technology is helping medical students learn while keeping patients safe.
Our plan is that residents and trainees will not be able to graduate unless they can successfully undergo scenarios in the simulator that duplicate what they would do in the real world. The simulator is a full-size mannequin which allows you to train on it without causing harm to the patient, even if you cause the biggest mistake. And only after they've achieved a certain level of competence, only then are they allowed to go out and do it on patients.
Dr. Barish is also implementing a simple color coding system for vials that will save lives.
An example is 2 medication vials that look exactly the same. If you'd like to design it out of the system, you change the color, the shape, the size of the vial, so that when that practitioner reaches for a drug, they don't pull the wrong drug. According to the Institute of Medicine report, between 44 and 98,000 people die preventable death every year. The goal in my life is to dedicate my career to preventing patient harm. And that is a process that's going to take several years, but the awareness is here.